February is Heart Health Month. Now, we've come a long way in understanding heart disease, but it continues to be the leading cause of death for both men and women. Dr. Sujatha Reddy shares important preventative tips for our In Good Health segment. So, Dr. Reddy, according to the CDC, heart disease is the leading cause of death for men, women, and actually people of most racial and ethnic groups in the U.S. Why is this the case? Why is this disease affecting so many people across the board?
Well, that's a great question. It absolutely is the #1 killer of Americans for sure. And part of that may be that there are multiple risk factors for heart disease. And the longer you live, it's almost inevitable that you will have possibly one or all of them, or more, some of them. The good news is a lot of them are reversible, like don't smoke or maintain a healthy weight or be physically active. So there are things you can do. But as our population gets older, a lot of risk factors are not always in your hands. Like as you get older, your risk of getting high blood pressure goes up, and that is a risk factor for heart disease. So the risk factors are very common, and that is why heart disease, or one reason why heart disease is very common.
Well, we actually asked our viewers if they had any questions for you on this topic. First one is from Sally. She says, I'm in my mid-30s. Both sides of my family have a history of heart disease and high blood pressure. How much does hereditary play a role in me possibly getting heart disease in the future?
And that's a great question. So family history is a known risk factor for heart disease, especially if you're the members of your family that have heart disease had heart attacks or angina at a younger age. The good news is, while you can't change your genetics, you can control all the environmental risk factors that around you, like being active, not smoking, maintaining a healthy cholesterol and body weight. The other good, exciting thing is because so many of us, and I'm in this group too, have a family history of heart disease, there are actually cardiologists now that specialize in something called preventative cardiology. And I would highly recommend talking to your healthcare provider about getting into a cardiologist, ahead of the time your youngest relative was diagnosed with heart disease or had a heart attack, so you can start planning how you can make changes to decrease your risk, but also what tests you might need sooner than the average person without that young family history of heart disease to help look for problems with your heart ahead of time. So preventative cardiology or a preventative cardiologist is a great idea for someone with a strong family history.
Good. And of course, Sally raises a great point about the high blood pressure and hereditary factors. And that leads me to ask about female-specific disorders. Are there any that really increase a woman's risk of heart disease?
There are a few that we could say are specific for women. We know as you get older, your risk goes up. We also know for women that after menopause, their risk seems to go up a little bit. So that is one thing. But also certain autoimmune conditions can affect blood vessels, and some autoimmune conditions like lupus are more common in women. Also rheumatoid arthritis. Some of these type of things can affect all blood vessels, including coronary blood vessels and blood vessels around your heart. So that may increase your risk slightly. So those are things specifically that women need to be aware of. But if you've got a good rheumatologist taking care of your autoimmune, they're going to know that, and they're going to advise you what to do.
Good, good. All right, another question. This one is from John. John says, is it true that a glass of red wine is good for your heart? It's a question I have as well, doctor.
It's a great question. So there have been some conflicting reports about this. We know that some chemicals in red wine might increase good cholesterol. You can also increase your good cholesterol with exercise, which is probably a healthier way to do it. I think, John, if you want to have that glass of wine, and we're not talking a bottle of wine poured in a glass.
Exactly.
We're talking a normal 6-ounce pour of wine. If you choose to have that, it probably is okay. I like to think all things in moderation, but I can't tell you that you should have that glass of wine because it's going to absolutely help you. So I think it might not, but I think in moderation is probably okay.
Great advice as always, doctor. Thank you so much for your time.
Thank you.